is accessible to everybody, and also making sure that it is affordable to everybody. So all these aspects were an eye-opener to all of us. And within the limits that we had, we did everything what a country could do or a state could do. We were more focusing on tracing, testing, and treating, because we, from my state's perspective, we are short on tertiary care, because tertiary care, we were a newly formed state, and we do not have a tier 1 city like Hyderabad or Bangalore or Chennai, where private investment is huge coming into in super specialty hospitals. So since we had that handicap with us, so we wanted to get into the early stage, detecting at the early stage. So we conducted almost 44 rounds of house-to-house survey. We had a robust system in place with the village secretariat at every village, volunteer system for every 50 houses. We had 42,000 ASHA workers, also the volunteers dealing with health issues be present. And all these factors put together, we initiated this process of house-to-house survey. And in this close to 2 years of this pandemic, we've conducted almost 44 rounds of house-to-house surveys. So that was one of the primary reasons as to why we could cut the mortality rate. Even though the country's mortality rate was 1.21%, our state's mortality rate was the lowest in the country, 0.63%. So that's one of the primary reasons.
So, Catherine, we're hearing about the challenges that have been experienced due to the COVID-19 pandemic on the healthcare system. But of course, not alone there. There's also a migration crisis that's testing already stressed healthcare systems, with disruptions reported in essential services and care in over 90% of countries.
I think the way we look at it from UNICEF is that there are cascading crises for children. Certainly the COVID crisis was a huge challenge for children. It drove, we're estimating, another 100 million children into poverty. It kept children out of school for months, if not years, right? It interrupted routine vaccinations. I mean, COVID was devastating for children, but you're right, it's not the only crisis. We also have conflict in Ukraine, which is, ending up in millions of people being disrupted there. Certainly children are leaving the country, children are moving around in the country, so displaced in the country. But it's also, I'm sure people have seen this in the press, but it's affecting wheat prices and oil prices, and that also has an impact on children. I was 2 weeks ago in Ethiopia, in the Horn of Africa, to see what's happening to children there because of the food shortages, and it's devastating to see it. Populations are moving because their animals are starving to death. People are severely malnourished, and I visited children in a hospital who were so acutely malnourished that you walk into the room and it's completely quiet because the babies are too weak to cry. So all of these crises are sort of impacting each other, reinforcing each other, and the impact on children is devastating. And I think when you look at, on the healthcare side, having decent primary healthcare in these countries would be incredibly helpful, and that exists in some places, but unfortunately not enough.
Mm-hmm. Lev, when it comes to the issue of sustainability and pricing, which can also be a barrier to access, what are you thinking of as AstraZeneca, and also when it comes to your carbon footprint?
Well, first of all, I think what we're seeing now are many of us, governments, but also companies, realizing that health and sustainability goes together, and especially so with climate change. And good examples of this is respiratory disease with air pollution, probably produces millions of deaths every year. Contagious disease is certainly one of those, but also everything that has to do with cancer, exposure to different substances, etc. In the case of climate change, we are trying to be doing our part. About 4 to 5% of the world's global footprint is actually coming from the healthcare sector. We are trying to be doing our part in our case by having reduced since 2015 about 60% of our carbon footprint up until now, and we are planning to go zero before 2026 in scope 1 and 2, and then 2030 also in scope 3. All of those are powerful measures, and of course the reason that we are doing that is that we realize that there is a real tie between the two. What is good, I think, is that the world is realizing that also. And I think there is a way to promote now both healthcare systems, sustainable and resilient health and healthcare systems, and climate at the same time. Then, over time, when it comes to access to medicines, that's going to have to be done by over time building resources in broader continents. The only alternative to that I see is really good trade agreements, but they then need sanctions so that we don't end up in the vaccine nationalism that we had over the past couple of years.
Speaking around that issue, Jay, just talk to me about the Access to Medicine Index. What is this?
So the Access to Medicine Index is a biennial ranking of the pharmaceutical industry's efforts in improving access to healthcare for about 106 low and middle income countries. And basically it's a research system where we evaluate the efforts of different pharmaceutical companies. So this is the biggest pharmaceutical companies in the world, the likes of AstraZeneca, who in the last index sits in the top 10 of that ranking. And what it ends up doing is we come up with best practices, we come up with gaps and opportunities in looking at issues such as future pandemics, issues such as children's healthcare, whether specific populations in the least developed countries are also being taken into account when you think about market access issues itself. And we bring the research to different settings. So companies use this research as a benchmark of their performance. Investment firms, such as the many different sustainability-linked ESG users, we have about 150 to 200 investment firms that use our work in engaging with the industry, and together they manage about 25 trillion US dollars in assets under management, and they use the money to basically they use the insights to invest differently in the pharmaceutical industry to push for long-term change and a more inclusive and stronger social impact in this work. And of course, governments, many of which have been growing in the usage of our work, use it to shape their policies and the strategic investments into healthcare. By defining where the gaps are and where the opportunities are, we try to make sure that people pay attention to the most critical issues in the environment. And we've basically now launching a new strategy now where we're bringing a more diverse group of players and evaluating that effort. So we're looking at big generics, medical oxygen, where there's only 6 manufacturers supplying the whole world's supply of oxygen to people all around the world. Vaccines, diagnostics, and a lot of issues such as local manufacturing, local availability is coming to light.